Hospitals are preparing for the challenging surge in pediatric cases to continue for at least 2 more months. The number of sick children going to emergency departments is being described yet again as unprecedented. Today, Doug Ford was at a facility that has been helping to hold the strained system together.
Wow. There's the team of champs. How are you?
Good, how are you?
The Premier toured an Orange Air ambulance facility today as part of a government announcement that it's replacing 8 aging aircraft. It's timely news. Ontario's healthcare system has been relying on Orange to transport young patients like never before. In November, the number of pediatric patients airlifted to other hospitals due to lack of available beds increased by 150% over the same month from the past 2 years. 4.5-year-old Remy is one of those patients. He was airlifted 350 kilometers from home.
So Remy was in critical care for 8 days. He was on a ventilator. He was sedated. And as soon as he came out of critical care and was considered stable, they immediately tried to start getting us to MAC because that's our home hospital. And here we are 2 weeks later, still in Kingston because there's no beds. That shouldn't be the case.
The lack of beds is due to respiratory viruses overwhelming hospitals. CHEO, the Children's Hospital in Ottawa, reports hundreds of young patients are coming to its emergency department for the flu this year, with 73 admitted last month. There are usually only 1 or 2 admissions. The hospital had to call in the Red Cross for assistance.
This winter, it's especially challenging as we have COVID-19, which did not go away. A very significant influenza season, and of course this RSV, respiratory syncytial virus, which came back with a vengeance as well.
Ontario isn't the only province grappling with an overwhelming surge in pediatric patients. It's a concern right across the country. The latest data from Flu Watch on the federal government's website shows the grim reality hospitals are facing. This graph shows the spike in cases. The solid line represents the sharp increases in influenza from across Canada since late August. Compare that to the dotted line, which traces last year's caseload. As usual, the eldest and the youngest are hit the hardest. Canada-wide, 54 influenza deaths have been reported since late August, 5 of them children.
It's tough times. We just have to call it how it is. When you couple, stretch capacity to begin with every winter season, personnel loss, and then COVID-19 added to the mix of other respiratory viruses, and then a more pronounced and significant resurgence of the typical respiratory viruses that we already see, it's a bit of a perfect storm.
The question is, how long will this unprecedented surge in respiratory cases continue?
Here at McMaster Children's, we are certainly preparing for this surge to continue well into 2023, well into January and February. We hope that we're wrong.
So how do you protect your children and yourself? Dr. Bogosh gives us the same advice we've heard so many times. Get your flu shot, get a COVID booster, and wear a mask in crowded indoor spaces.